Can urachal remnant lead to bladder adenocarcinoma? Have you ever wondered if a urachal remnant could lead to bladder cancer? This is a crucial question for understanding bladder health. A urachal remnant is a leftover structure from fetal development. It connects the bladder to the umbilical cord. Normally, this structure closes after birth and becomes a fibrous cord. However, if it remains, it can lead to complications, including infections and tumors. One of the most serious outcomes of a persistent urachal remnant is the development of urachal adenocarcinoma. This is a rare and aggressive form of bladder cancer. In fact, about 80% of cancers that arise from urachal remnants are adenocarcinomas. While urachal adenocarcinoma accounts for less than 1% of all bladder cancers, it is known for its poor prognosis. The challenge with this type of cancer is that it often presents late. Early stages are usually asymptomatic, meaning there are no noticeable symptoms. When symptoms do appear, they can include blood in the urine, abdominal pain, or a mucous discharge. These symptoms can indicate that the cancer has invaded the bladder and surrounding tissues. There are documented cases where benign urachal cysts or remnants have transformed into malignant adenocarcinomas. This highlights the risk associated with persistent urachal remnants. To mitigate this risk, early surgical removal of these remnants or cysts is often recommended. This proactive approach can help prevent malignant transformation, as urachal cancers are notoriously difficult to treat and have high recurrence rates. Treatment for urachal adenocarcinoma typically involves surgical excision of the urachal remnant along with a partial cystectomy, which is the removal of part of the bladder. Surgeons often aim to completely remove the urachus, umbilicus, and surrounding tissue to reduce the risk of recurrence. In some cases, chemotherapy may be considered, but standardized treatment guidelines are lacking due to the rarity of this condition. In summary, persistent urachal remnants are indeed a recognized risk factor for developing urachal adenocarcinoma, a rare but serious subtype of bladder cancer. Monitoring and timely surgical intervention can play a vital role in preventing malignant progression and improving outcomes for patients. If you have concerns about bladder health or symptoms related to urachal remnants, it is essential to consult a healthcare professional for personalized advice and treatment options.